Hello, everyone. Happy Tuesday. We're in day 2. Day 1 was so awesome. I'm your host, Dr. Sarah, board certified occupational therapist, and I'm so excited to have you back. I'm going to kick off the day again today, and then we have a couple more awesome speakers coming in this afternoon. So I've got a lot to go over today, and the way I kind of went through my content for you guys, because I get to speak each of the 5 days, is that the fascia part was informational yesterday. So you learned about what fascia is and how to treat it and how to take care of it. And then today is going to build on that. So we're going to talk about posture and alignment and how your fascia factors into that and how your posture and your alignment factor into your lifestyle. So then tomorrow we'll be talking about some stretching and some things that you can do to kind of correct the information that you're going to learn today. And we'll keep moving on through the week. So it kind of builds. So if you're catching this in the replay and you haven't seen yesterday's video from me, go back and look at that because it's pretty important. So let's get started on posture and alignment. I think a lot of times when people say posture, or people don't really use alignment in conversation, but when you talk about posture, what you're really talking about, the really important part is alignment. So the technical definition of posture is the position in which somebody holds their body while standing or sitting. And that's pretty basic. So I'm going to take it a step further and say your posture is the position that you put your body in order to produce a functional or sometimes an aesthetic outcome. So you have a posture when you're riding a bicycle, that's correct form. Gymnasts do certain postures as part of their routine. Jockeys have a posture. Models, when you're walking the runway, that is definitely a posture because they want to emphasize certain parts of the body and de-emphasize other parts and emphasize the clothing. And so they are changing the way they're moving their body within that space to produce that outcome. Now, alignment is the arrangement of the parts in relation to the other parts. So your spine, if you're looking at it from the front or the back, it's supposed to be pretty straight. And you can see in the X-ray on the right over here that this person has scoliosis, and that is an abnormal curvature of the spine. And obviously, this is a severe pathological misalignment. Most people do not have this, but it illustrates the point of alignment. So this person does not have correct spinal alignment. They may never have correct spinal alignment because of this defect. So posture and alignment kind of play off of each other. Your alignment, which is kind of facilitated by your fascia, like we talked about yesterday, comes from your postures. So if you spend your entire day in one single posture, that's certainly going to dictate your alignment. It's probably going to pull you out of line because you're supposed to get a lot of different kinds of movement. But your posture is not as important as your alignment. Like those different sports, like the gymnasts, like the bicycling, you're going to move through different postures throughout the day. You know, you sit at your desk and you work. You get up and you go for a walk. You might go for a bike ride. All of those things are different. And so as long as you are regularly moving through different postures, each of those postures individually don't really matter all that much. So you can slump in your chair when you're working if it's comfortable. If you need a break, lean back, kick your feet out. But that's only okay as long as you are also comfortable in correct alignment. So if you have to force yourself to get your shoulders back or to straighten your back out, then you need to spend less time slumped over in your chair at work. Unless you're always in the same posture. So you get up in the morning and you sit at the table and eat your breakfast. And then you get in the car and you drive to work. Then you sit at work and you do your job. And then you come home and you eat dinner again, sit on the couch, comfy couch that you just melt into. It's so amazing at night. Watch some TV. And then you roll over and lay in bed and you're in the same position the entire day. You've had no variation, no changes in posture. And so then that posture does become more important than the alignment. And like we talked about yesterday, you become the Play-Doh man. You're all dried out in the same position because you haven't been moving enough. So what is good alignment? When we talk about alignment, we're going to look at certain parts of the body, landmarks, that will determine if those pieces are in the appropriate relationship to the other pieces, essentially. So if you're looking from the front, the first thing you're going to look at are the collarbones, the clavicles. You're also going to look at the anterior superior iliac spine, which is just a fancy name for your hip bones, point out the front. You're going to look at your knees, and you're going to look at the long bones of the feet. And I'm going to go through each of these component parts moving along as well. I just want to start out with the landmarks so you know where we're going. So from the side, you're going to look at the ankle bones, the fingers and the thumb, the angle of your sacrum. Are you tucking your pelvis? Are you sticking your butt out? The point of the shoulder to see if your shoulders are rounded or straight. And then your ear canal to see where your head is in alignment to the rest of your body. From the back, you're going to look at like the top of your hip, the iliac crest, the tendons in the back of your knee, and then your ankle bones. So, proper alignment. It is amazingly hard to find a good example of proper alignment on the internet. I was amazed. This is the best I could come up with. You can see her feet look like they're pointing fairly straight forward. Her ankles are over her heels. She's back, her weight is back on her heels. Her knees are over her ankles. Her hips are over her knees. Her shoulders are over her hips. And her ear is in line with her shoulder. So she's a stacked line all the way from the top to the bottom. And her fingers and her thumb is pointing mostly forward. And her fingers are close to the seam of her pants on her side. And that's important for the relationship of your shoulders, because you have a lot of rotational motion in your shoulders that can become compromised if we spend too much time in one posture. So starting at the bottom, I love to start at the foundation. Your feet are so important. Your toes. We cram our toes into these tiny little pointy shoes. And this poor woman's foot looks so bad. I don't know what that bruise is from, but she's got this bunion on the side that's probably the result of having spent a lot of time in shoes like heels, because they have a tiny toe box. You're scrunching your toes. Your toes really should be straight. They should go straight out from the long bones of your feet. So when you scrunch them in, you are increasing the tension and the inflammation in that big toe joint. And that's going to cause more swelling. It's going to cause damage over time. And that's how you end up with bunions. So little baby feet. Who doesn't love little baby feet? Babies are my favorite. And they have the most mobile little feet. They move their little toes around when they're exploring their world. And as they get bigger and they start walking, we start stuffing their feet into shoes. And I'm going to come back to shoes because I've got a bone to pick with shoes. And we start losing the elasticity of our feet and the flexibility of our muscles and our brain's ability to control those muscles. So your toes really should go straight out from the long bones of your feet. They're a continuation of those bones. So if you find that you end up wearing shoes like that a lot, we all have, our preferences for footwear, like clothing that we have to wear if you have professional wear for work. You can get something like a toe spreader that will help stretch your toes. It helps relax the muscles, the intrinsic muscles that are deep in the feet between the bones, and will help straighten your toes and reduce the friction on those joints. Feet. So not just your toes should be straight, but your feet should also be straight when you're standing, when you're walking, when you're running. They shouldn't go out, and you shouldn't be pigeon-toed. I find that most people tend to be this way. I think because it's kind of generally more accepted. Like you see somebody who's pigeon-toed and it's obvious, you notice it. But a lot of people stand with their feet out and nobody really thinks anything about it. So I think it's not corrected as often because we just don't notice it. But really your feet should be straight forward. And when you don't do that, I talked about the knee a little bit yesterday, but your knee is a hinge joint. It's like the hinge on a gate. It goes your lower leg goes two directions. So if you imagine your lower leg is the gate, you can open and close the gate. But if you put a weight on the end of it, you change, if you can see here, you change the pressure on that hinge. And that's where the osteoporosis comes in. osteoarthritis, because you're increasing the wear and tear on that joint because it's not meeting the way it's supposed to be. And your feet are a big indication of that. Excuse me. So aligning your feet, when you stand, your feet should be stacked under your hips from the front or the side or the back. You shouldn't have your feet close together. You shouldn't have a wide stance. Normally, you should just stand with your feet under your hips, and they should point straight forward. Ankles. I think our shoes are also a big factor for our ankles because a lot of people have weak ankles. But you don't really have weak ankles. You're just not recruiting those muscles properly. You're not stacking yourself properly. So a correctly aligned ankle will be straight up and down. That Achilles tendon in the back will be a straight line. And they are, I know in these pictures, it's kind of hard to tell because the tendon itself still looks pretty straight, but it's just got a little curve in it, whether to the side or the other way. And this is the same foot in these three pictures. So if your foot rolls to the inside, if you have flat feet or a fallen arch, you're pronated. You should be neutral, have a bit of an arch, or you can go to the outside and be supinated and be walking on that outer edge of your foot. And not only does that change the mechanics and the dynamics of your foot as you're moving, but it also affects your knee in the same way we were just talking about. It changes the pressure on that hinge. So making sure that your ankles are stacked straight up and down over your heels is really important. Knees. I couldn't find a good picture for knees. So these are my knees. So this is my bad example. A lot of people kind of dump their knees inward. And that comes from strength in your hips. So you could have weak glutes because you spend a lot of time sitting or you're not doing the appropriate exercises. And so the symptom of that is that your knees point inward. And so if you imagine lasers coming out of my kneecaps, in that second picture, when they're facing forward, they would cross. Those lasers wouldn't go straight out. And if you look from behind, you have ligaments on either side of the back of your knee, essentially. And you should be able to see both of those pretty clearly from the back when you're standing. That indicates that your kneecaps are actually pointing forward. So if we look at a better example, now I've straightened out my knees, I've engaged my glutes, I'm standing properly. You can see both of the tendons on either side of my knee from the back. And if you shot those lasers out of my kneecaps, they'd be going straight forward. And that's comes up to your hips and your glutes and the alignment of your hip socket in that joint. So it's not, your knees falling in is not an issue with your knees. It's actually an issue with your hips. So a lot of times when people are having knee pain, they're trying to solve the problem at the knee when the knee isn't the problem. I mean, yes, that's where the pain is, and ultimately that's where the damage is, but you have to think about, why is that knee out of alignment? What is causing the pain to happen? And that comes up to the hip. Hips. Today we're going to have somebody talking, Dr. Tamara is going to talk about pelvic and core alignment and why it's important and what it affects and all that. So I'm going to let her go deeper into that. But for alignment, your pelvis should just be level and straight. You don't want to stick your butt out. You don't want to tuck your butt under. You just want to have it straightforward over your heels. Because if you even if your pelvis is level and you shift it forward so that it's over the fronts of your feet, you're changing the angle of your alignment all the way up and down. And the pelvis really is the greatest control point of the body, especially if you're thinking about moving from the hips up. So if you're sitting down right now, I want you to try this. So if you slump down, get your back nice and round, and try to get yourself into better alignment. Pull your head back, move your shoulders around. It's kind of hard to do when you're sagging in your hips. But if you sit up and you get your hips set up properly, get a little bit of a curve in your back, all of a sudden now it's hard to slump. You can't slump when your hips are in correct alignment. So that alignment connects all the way up just from the hips. So this is kind of what we were talking about. When you're born as a baby, you have no spinal curves. It's just a C shape. And that's why they're so good in the fetal position, and they just scrunch up and they're so small. And so tummy time is really important because that's when that first cervical curve starts to develop. They start to get that curve. They start to engage their back muscles. They start to strengthen their back muscles. They start to gain control of their upper extremities. And then they start to crawl. And that's going to increase. So you have a bit of a curve in your cervical spine, in your neck. And you have the opposite curve in your thoracic, in your upper back. And then you have another curve in your lumbar, which is your lower back. So they're going to work on, between tummy time and crawling and the different types of locomotion that they move before they start walking, they're going to develop those curves because those curves are vital for balancing and distributing the weight when you're upright. And what happens, and why so many people have back problems and herniated discs and things like that, is because we're not respecting those curves. We sit slumped, or we have, that tech neck. And as you can see in that middle picture, when you change that curve, when you straighten out something that's supposed to be curved, you're increasing the pressure on those discs. And it might not be the discs, it might be the nerves, it might be the blood vessels. Everything comes out of your spine, all the way to the rest of your body. So if you're having symptoms somewhere, you may have to go all the way back to the spine to figure out what's causing that pain. And you can see in that bottom right picture, that's a herniated disc. It's popped out. It's not supporting those vertebrae anymore. And recovering from a herniated disc is very challenging. And so certainly it's best if you can just avoid that, and knowing proper alignment and how to get there and what that looks like, and ultimately what it feels like for you in your body, is the most important thing. We're moving fast up this. We're already at shoulders. So the entire purpose of your shoulder is to position your hand. Our hands are our most functional tools. We use them to do everything. And so that shoulder has a lot of different directions it can go. It's a ball and socket. It moves around. It has, rotational motion. It has up and down. You can turn it. You can rotate it. And so that also means that there's a lot of things that can go wrong. So one of the big things is internal and external rotation. So you can think about internal rotation as crossing your arms. You're changing the rotation of the humeral head inside the socket. Or external rotation is the opposite, like you're holding a tray. And your shoulder actually has 4 joints. It's not just the one we all think about. It's an entire system. So the first one is your sternoclavicular joint. Connects all the way over here where your clavicle connects to your sternum. And you can feel, if you put your hand on your clavicle right in the middle and you lift your arm, you can feel how much your clavicle actually moves. It rotates and it drops down a little. And that allows more motion in your shoulder. Second one is the acromioclavicular joint. So that's where your clavicle connects to part of your scapula on the back, but it's kind of up here on the top. And you can feel a movement there as well. Most popular shoulder joint, glenohumeral. That's where your humeral head connects to your scapula, the glenoid fossa. And that's the one we think about when we think about shoulder replacements or torn rotator cuffs, things like that. That's where the damage is. And the last one is the scapulothoracic joint. And this one is very much not recognized for the role that it plays. So your scapula, your shoulder blade, actually has a lot to do with the motion of your shoulder. It has to slide over your ribs, has to move up and down, side to side. And then it even rotates this way. So you can kind of, if you put your arm on the side, you can feel when your scapula rotates to allow your arm to come up over your head. And so if you get any kind of tension or tightness in any of those muscles in your back, your lats, now I can't come up with any of the muscles, all these muscles in your back, if they get tight, if the fascia gets tight, you're going to restrict the movement of your scapula, you're going to restrict the movement of your shoulder, you're going to limit the motion of your arm. So, what's causing poor alignment? We talked about movement, but there are certain things that most of us do every day that ultimately is affecting the way our body is aligned. The chair. I talked about yesterday how modern society has made our lives so comfortable and that it's to our detriment, because you get up for work and you sit in your car, you come back, and then you sit in your chair and you melt down into this cushion that's not providing any support for your body. You know, on the weekends, it's so easy to sit there all day and watch TV because it's so comfortable, but it's not giving you the support that you need. And so something that I had to look up, the chair, as we know it, the modern chair, I mean, the chair was invented the first time a guy sat on a rock, but the modern chair, you know, 4 legs with a seat in the back, was invented, they think, about 3000 BC. So it's about 5,000 years ago. The oldest dated fossils for Homo sapiens are about 300,000 years old. So quick math, that's about 1.6% of our span as human beings that we've had a modern chair. Your body is not adapted to it yet. And who's to say if it will be? You know, as before all the comforts of modern society, people were moving, they were hunting, they sat down for a rest, and then they got back up and they carried on. Or they spent most of their time squatting doing their work because they were working on the ground, not working at a table. So the chair has not been a major factor in our biomechanics for very long. And so it's a big factor when you think about its impact in our lives today. Another modern marvel, the car. I have talked to many, many people who think they have a leg length discrepancy where one of their legs is a little bit shorter than the other one. And they're wrong. There are actually very few people who have a pathological, a diagnosable, anatomical leg length discrepancy. But these people are like, oh, my legs aren't the same length, I'm going to go out and get a riser for my shoe, when really their fascia is tight somewhere and it's pulling their leg up. It could be their back, it could be their hips. And a big factor in this is the car, because none of us position ourselves correctly in the car. If you're reaching for your gas pedal, you're changing the dynamic in your pelvis, you're changing the dynamic in your back, you're recruiting muscles unilaterally, and your fascia, which is trying to protect you and trying to provide structure for your motion, is going to thicken in those lines so that the next time you go to do that, it's not so hard. And so you end up with a leg length discrepancy. And I can never remember if it's that the right leg, because that's your pedal leg, is shorter, or if it's your left leg that's shorter. But it is related to being in the car and spending so much of our time driving. Shoes. We looked at that poor lady's feet earlier. I cannot imagine how much pain she must be in, and our feet are so important because they take us everywhere. And so the shoes that we cram them into are causing so much damage. They're moving our toes. They're causing, causing the muscles in our feet to waste away. They are changing the way our bones and our joints articulate within our feet. And so making a conscious choice to choose good footwear or to be barefoot will go a long way towards maintaining the health of your feet and even getting back to where your feet are healthier. So I wanted to talk about a few ways to kind of mitigate the problems that we have. So we'll talk about setting up your workstation first. And a lot of us have transitioned to working from home with the current health crisis. And we're probably not as equipped to have a good workstation as we were when we were at work. So I've spent, and I've only worked from home, but I sit at my dinner table and I stand in the kitchen at the counter, and sometimes I sit on the couch, and I have this big, enormous, solid oak wood roll top desk that I work at most of the time. And that's fine, but it's about finding ways to position your body correctly and changing your position as often as you can. So ideally, you sit in a chair that has back support, not that's leaned back or that's pushing you forward. You want to be able to reach, your elbows should be down by your sides at about a 90-degree angle, and you want to be able to reach your keyboard and your monitor, and this one's important. Your eye line should be 2/3 to 3/4 of the way up your monitor. So the top is not level. I've heard that one a lot. It needs to be a little bit lower than the top needs to be a little bit higher, but your eye line needs to be a little bit lower than the top. And your feet need to be flat on the floor. So if you're tiny like me, I have a little stool that I put my feet on when I'm sitting at my desk because my chair is too tall, because my desk is so tall. So I positioned myself high enough so that I can comfortably work at my computer, but that means that I need to get something under my feet, or I have this crazy pressure on my thighs from where they sit on my chair. And like we talked about, the guy on the right, it's not great posture, but that's not as important as whether or not he has good alignment. If he has good alignment, he's going to be okay, because this is going to be temporary. So you can sit here when you're working, you got to get something done, you're really focused, and it's okay. But you have to be able to get back or move back, even if that's physical locations, to where you are in a better posture to support that good alignment. Driving position. It seems pretty self-explanatory, but it's a challenge to actually get right sometimes. You want to be able, the most important thing is you want to be able to reach the pedals without stretching your leg out. So you don't want to be so far away that you have to drive with your toes. That's going to cause strain in your muscles. It's going to cause problems in other places as well. But it's going to unbalance your hips, and it's going to change the relationship of your pelvis to everything else. So if you spend a lot of time driving, it's worth going out and sitting in the car and getting it set up just right. But also remember that if you're going to be driving for a long time, take a break, get out and walk around, do some stretches. If you have, like a long stretch of highway, use your cruise control and put your feet flat on the floor so that you're sitting squarely. And that'll help over time to prevent that misalignment from happening. Footwear, I told you we were coming back to shoes. I do have a bone to pick. Heels are one of the worst things that you can wear. And they're pretty. I love shoes. But when you cram your shoe, start at the toes. Cram your toes into this tiny little toe box because that's what society says is pretty. And you're going to end up with bunions and nerve damage and a cut off blood supply, pain, bruising. And then, because your feet are meant to be flat, you were designed to be barefoot. When you lift your heel, it's like putting a wedge under a bookcase. And the more narrow that bookcase is, the more significant that becomes. So it doesn't take much to put a narrow bookcase totally off. And so what happens then is that you have to compensate by bending your knees or arching your back or pulling your shoulders up. And so then you, instead of being a straight line from your heels to your ear, you're a zigzag because you're trying to counteract those weights, that pull from gravity, so you don't fall over. And you're also changing because you have like 26 bones in your foot, a ton of bones in your foot. And each of those little articulation points, when you change, the relationship of the bones changes. So now your foot mechanics are off. It's hard to walk. This is why so many people struggle with heels. They're not natural. Your foot is not supposed to do that. And we make it do it anyways. And occasionally, it's probably not really going to cause you a significant amount of damage unless you trip and fall. And then that's a different story. But making sure that you're doing things to counteract that damage, to counteract that tightening of the fascia, will make it better if you need to wear heels occasionally, if you want to wear heels occasionally. Being barefoot. Barefoot is the best thing that you can do for your feet. And certainly, shoes have been designed to protect our feet. There's a lot of danger out there. There's a lot of bacteria. There's a lot of sharp stuff. But when you put on shoes, you're restricting the recruitment of those muscles. You are limiting the movement of the foot, and you're changing your gait. So by being barefoot, you get to increase that muscle control and recruitment. So you're using those muscles as they were designed to be used, so they don't waste away. You're getting better foot mechanics. You're getting increased sensory input because your brain is constantly looking for input from its environment to figure out what's going on. And so when you put on shoes, you got thick socks, thick-heeled shoes, even if they're, orthotic running shoes, your feet are no longer getting that input from your environment. It's changed. And so your brain doesn't recognize it the same way as it does when you're barefoot, which is why being barefoot also gives you better balance. Not just, it's a combination of better control of your foot and the increased sensory input. But this is a big thing with our older population where they've had foot pain or damage to their feet. And so we've stuffed them into these really rigid, really thick shoes where now their feet are not working anymore. They can't feel the ground. And then they have a fall. And now we've got a broken hip. And the mortality rate for a broken hip is very bad. It's like, I don't even know if I want to make a guess at it. I haven't worked in that setting in a long time, but a large number of people die within 5 years of breaking their hip. So if we can avoid the hip break, you can avoid some of the snowball effects that come and result in that death. And it comes down to taking care of your feet. Be barefoot. Also, earthing. If you caught Sharon's talk last night, she talks about how we're electrical beings, and it's true, we are, and the science backs it up. And our environment is also an electrical space. So when you go outside and you put your feet on the ground, and I'm not talking about concrete or man-made stuff, but you walk in the grass, you walk in the dirt, you walk on the beach, your body gets those electrons from the earth, and it actually changes your physiology. They have done EEGs, electroencephalograms, where they're looking at the electrical activity in the brain, and people who have been earthing have changed brainwaves, changed for the better brainwaves. Also, it increases, and I don't know the exact mechanism of how this works, but I think it's amazing. It increases the surface area of your red blood cells, which makes your blood less viscous. It makes it less likely to clump, which reduces your risk of blood clots and heart attack and embolisms and all kinds of, so just getting out and walking barefoot can have all of these physiological effects that totally change the way your body's functioning. And it's really amazing. So, biggest takeaway from today, go be barefoot. Go outside, walk in the grass, walk in the dirt, go be barefoot. As often as you can, be barefoot. If you have to wear shoes, if you love shoes, your best option is looking for a shoe that has no heel elevation. So it's zero from the front to the toe. These two examples that I pulled up happen to be Vivo shoes. I don't own a pair. I'm not sponsored by them or anything. But based on my research and what I know, they look to be pretty decent shoes. I don't know cost-wise what they are. I didn't look at them that closely. But they have no heel. They emphasize a wide toe box so that your feet have enough room to actually work inside of them. And they're pretty secure. So one of the problems we have with flip-flops is that your toes constantly have to grab as you move. They have to hold on to your shoes because your shoes aren't secured to your feet. And this is a problem. So if you want to look for a shoe that you can wear more often, that you can wear out, these are the criteria that you should be looking for. Flat, wide, and it is firm on your foot. But also, no, I say firm, but I shouldn't say firm because the shoe should be very flexible. It shouldn't be rigid. It shouldn't be firm. It shouldn't have a thick bottom. You want that shoe to interfere with the normal mechanics of your foot as little as possible. If you've had kids, maybe you've seen the little leather bottom moccasins shoes that they make for babies. And it's great when your kids start walking and you want to start taking them out places, and they need to have shoes to protect their feet because it's a crazy world out there. But you need to find shoes that inhibit that motion as little as possible. And so it's the same for grown-ups. We need to be using our feet the way they were meant to be used, the way our babies use their feet. And so we need to go back to the way we treat our babies. Find some shoes that are thin and flexible and fit our feet just right. So we went through the posture, we went through alignment, we talked about the things that are kind of in your life that are affecting the way you use your body. So now, how do you evaluate your posture? And it's pretty simple. We looked at all the landmarks. You just have to take pictures. Take a picture from the side, take a picture from the front, take a picture from the back. It works best if you can throw on like a tank top and some shorts so you can see all those landmarks. And go through and look at your pictures. Am I straight up and down, or am I leaning forward over my feet? Am I sticking my butt out? Am I tucking it under? You know, are my shoulders rounded? Is my head in line with my shoulders, or is my neck stuck out forward? And I said tomorrow we'll go through and do some stretches and some exercises and stuff that you can do to correct any of these issues that you find. So you'll know where you want to focus. And it is true, I said with fascia yesterday, the problem is not necessarily where the pain is, but when you're looking at alignment, it's pretty safe to say that if your head is forward, you're probably doing too much of this, so you need to pay attention to your posture. And it's this fascia and this fascia that needs to be addressed to correct that alignment. So fixing alignment is much easier than fixing pain. And if you can fix the alignment before you get to the point of pain, it's even better. I think I went through that pretty fast again. It was a lot of information. Does anybody have any questions? I'll check the Facebook group and see if anybody's commented. But otherwise, if you guys come up with questions or feel like I didn't fully address anything, please let me know and I will be back to it, and I will get those answers for you. Otherwise, I will be back at noon Central Time with our next speaker, Dr. Tamara, talking about more alignment. So come back then and check it out. Thanks, guys.